My idea is to create a magnetically controllable hormone replacement therapy, or HRT. You may have heard of HRT being used for gender affirming care, whether that be estrogen or testosterone supplementation. It can also be for human growth hormone, for example, in children that have growth hormone deficiencies, that can be supplemented. And also, insulin treatment for diabetes is considered HRT. Um, and so I actually have personal experience with this because my dad has lupus, which is an autoimmune disease, and that can cause low testosterone. And a few years ago, he started getting super lethargic and napping all day, every day. Um, and eventually, after some testing, they realized it was because of his testosterone levels from the lupus. And so he's been getting testosterone injections every 3 or 4 weeks. Um, and they use a massive needle, and there are only a few injection sites on the body that they can rotate between. So what happens is you end up with a lot of repeated, prolonged injections to the same place, and that can damage the tissue there, and you end up with either fat buildup or breakdown in those areas, as well as some other just adverse effects to the skin. And so I'm sure patients would opt for a less invasive option if there were one, which is why I'm proposing this magnetically activated solution. So essentially, I work with a protein called EPG, which is magnetically inducible. When it's not in a magnetic field, it should be what we would call open. And then when you apply a magnet, it folds sort of like a hinge and closes. Um, so if we take a transcription factor for any of these hormones and we split it in half, we can attach each half to different ends of EPG. And those should be separated when EPG is off. And then when we activate EPG with the magnet, it should fold and reconstitute the full transcription factor to a functional state. And so here's an example using testosterone. The active form is DHT. And so there's this irreversible conversion at the very end of the process. You can see in these blue squares here, catalyzed by SRD5A2, where testosterone is made into that DHT irreversibly. And so I just looked up, how do we control SRD5A2? And it looks like there's a transcription factor called sterol regulatory element binding protein, or SREBP. And so I figured we could apply that to this split EPG model where we look for a split site in SREBP and we attach either half of it to the ends of EPG. And then once we have that construct created, we can introduce the gene for that construct into whatever location in the patient's body that the expression should be controlled. And this is a very far-fetched idea, but it would be awesome if we could control things like insulin production with magnets instead of, daily injections. So yeah, it's a ways down the road, but I would love to see this happen in my lifetime.